Welcome, everybody. Today, we are very excited to host Dr. Camille Kolu on the podcast. She is a behavioral scientist from Cusp Emergence in Colorado. Welcome, Camille.
Thank you so much. Nice to be here today.
We actually reached out to Camille. I would say Shayna took her course through Cusp Emergence University, all about, trauma-informed care. And we just found it so fascinating that we are very excited to hear more from you. If you could start by introducing yourself to our audience and tell us a little bit about your background in ABA, but also especially how you came to this as a topic.
Okay. Something we actually didn't confirm was I'm wondering which course you took, Shayna. Was it trauma sensitivity? Is that the one?
I'm about to look it up right now.
You think that's it?
It was the 3 hour.
Open. It's trauma sensitivity.
It was the 3-hour course on trauma sensitivity. Yeah, it was fabulous.
I'm so glad you took it. There's so many different ones, and they're all related to trauma in some way. But I really didn't start there. Thank you for having me on, by the way. I love what you do, and I'm really, really excited to be here. I am a little bit older than probably some of your listeners, and so I will share that I got started around the late 90s. And nobody, I think this is true, nobody was doing what I started to call TIBA, or trauma-informed behavior analysis. Nobody was doing it back then. Most of us were working with people with developmental disabilities, autism, the elderly, all these wonderful ways that we apply behavior analysis. And I really loved that. I have a bachelor's and a master's degree from University of North Texas. And that's where I got to work with some people who just really paved the way for me to have exactly the behavioral environment I needed to go do whatever I wanted in behavior analysis, right? And so I went from there after working with Jesus Rosales Ruiz and Dr. Shala Lai Rosales. I was working on autism, but also schedules of reinforcement. I also loved animals. And when I went to get my PhD, I went up to Rutgers in New Jersey. And so that's where I met my husband. That's where I did work on rats and mice, autism, genetics, olfactory contextual conditioning. And how do you reverse that stuff? And what does that mean for learning in the brain? And so that seemed to put me right where I needed to be, because when I got to Colorado a few years later, around 2010, almost every client I had was going through some kind of rough time, right? Some of my clients were just typically developing humans who were in prison, kids in foster care, the caregivers who worked in those kinds of settings or parented those kind of children. And you know what? A lot of what we were doing was not working for the backgrounds that they had. And so I just looked at the background as kind of this contextual variable. This is just like all of those other things. It's just that we need to document these effects of history and context on behavior. And when I started trying to do that, I realized there wasn't a great set of documentation tools for me to do that. So I kind of made my own. I started working in that space, doing a lot of transition support, and then realized other folks in my field really loved the tools. And so I got some amazing feedback by piloting these in various populations. And so that's kind of what led me to trauma.
It's really interesting. I got into the field in the late 90s as well. And it was I feel like it was the wild, wild west, when we were, trying to manage challenging behavior. I mean, we were just on the cusp of going, oh yeah, we should probably look at function, because back then it was topography and, oh yeah, maybe function. And then, starting the research with, functional analyses, but it only went so far. And, okay, there's only 4 basic functions and here they are. And I mean, we know now, fast forward, a million years later, we know that there's a lot of other contributors to challenging behavior. But you're right, it wasn't until probably, late 2010s, but even later than that people really started thinking about, oh, there's this other piece to it that could be trauma, anxiety, all of these other contributors to challenging behavior. And I think when I came across Cusp Emergence University and, took your course, I think in your course that I took, it was it really highlighted that, yes, there's trauma and there's the big T traumas, but there's also smaller traumas, right? The trauma that, is trauma for one person isn't trauma for another person. And, there's like these smaller traumas as well. But not only do we have traumas for, the people we work with, but some of the staff as well also have their own traumas. And when you're parent coaching, some parents have their own traumas. And we really do need to take a holistic approach and really approach, ABA, managing challenging behavior, teaching skill acquisition, training, with a very trauma-informed lens. So that's why we're really happy to have you for our upcoming CEU.
Oh, thank you so much. There was a lot of infighting. I'm sure you kind of remember this. I am not a clinical psychologist, right? So I used to describe myself as a behavioral neuroscientist with a BCBA, or you can reverse that if you want. Either works. And I don't care so much what somebody's been diagnosed with, except to the extent that it does inform us a lot about the history that they have been through. And those buzzwords, trauma and TIBA, I even went so far a few years ago when I coined the term around 2012, I believe, on my blog. And I even wrote, I know this is redundant. It is, and I'm going to use it anyway. I'm using it intentionally because I'm connecting now with all those social workers who are screaming at me, but what about trauma? And as long as I sort of ignored them and shut them out and said, but I just care about functions of behavior, they would say, okay, clearly you don't get it. And I wanted them to know that I was listening. So that was intentional. But to fast forward to something neat that you shared, Shayna, you're right. It's not about big T trauma all the time. And something really cool that we're learning about is how just plain old aversive experience changes the brain. Of course, it's huge in behavior analysis, right? Just huge conditioning, right? However, the fact that stress causes these detrimental long-term changes that are, cumulative, I found that very compelling as a reason to document those things and to find out what are the things we could be doing to prevent that kind of damage. What would it take as behavior analysts for us to look at those aversives really intentionally and with this idea about constructing an environment to minimize those or to create the repertoires to deal with them in ways that doesn't hurt. And so I don't want to avoid all aversives. I think that kind of experience is sometimes really important. It's a teaching tool. It's part of life, all of that. But we have to recognize some of it is harmful. And there's a lot more of it than there has to be, if that makes sense.
Yeah, for sure.
Totally. And I think we talk in behavior analysis as versus, like you said, more on the consequence side of things as a punisher, as a way to reduce behavior. But I think now the shift is more like as on the antecedent side of things. And so would you put trauma as in terms of the 3-term or 4-term contingency? Where does that fall? Is it an MO? Is it a setting event? Is it like, how do we define that in behavior analysis in a way that it still controls behavior? Or is it just a consequence that controls future likelihood of behavior?
Oh my goodness. What a brilliant question. Think about how reductive we would be if we tried to say trauma is a setting event, right? Or it's one thing. No. It is defined in whatever way it happened to me, right? And so if it is a contextual variable that is always present in someone's life, some kind of temporal context variable, maybe it's my daughter and I this morning, we were baking cookies. Like I was telling you before we started recording, her great-grandmother was 100 and recently passed away. We got the opportunity to go to a geography fair. And she's doing this fair poster on Estonia, which is where all of my husband's relatives are from. And so as we're making this amazing piparkukid, like gingerbread, right? This recipe from Estonia, I started telling my 6-year-old daughter all about conditioning. And she's like, well, everybody smells cookies and thinks this is an amazing smell, right? I said, well, what if your dog died the day that your mom made cookies for the first time, and then forevermore? I was like explaining to her, this is where the olfactory epithelium is in your nose and your brain, and
Your
this
poor
is how
6-year-old.
conditioning works. I know. She was like eating it up, so fascinated. She's used to me. And the cookies were smelling great. And she's like, so I think of cookies as this amazing Christmassy smell, but somebody else might think of it differently. Like, yeah, kid, exactly. So it's not one thing, right? Yes, it contributes different effects. Yes, it can act as an MO, condition MO for sure in a lot of cases. But also look at all the RFT things. You've got transformation of stimulus function. You've got people who learners are afraid to approach because of their resemblance to someone else. So you've got condition suppression in the presence of a punishing person who gave out punishing stimuli at some point, right? So it's all of that. I used to have a page on some of the ways we talk about what trauma is if we discuss it behaviorally. And it was so long, it slips the page. I mean, it was conditioning variables, operant ones, respondent ones, RFT ones, ACT one, all of that. It is all of that.
Complex.
Yeah. And it doesn't have to be. You can talk about it simply too. And you can just talk about how the influence of the past is, I mean, there's always a way to connect with a person you're sitting in front of. But if you want to get complex and behavioral, you could do that.
You talk a lot about buffers. Can you explain that a little bit more?
Absolutely. And because I'm working on being more mindful and in the present with my children who are about 3 and 6 and have really benefited from me doing that, I'm going to just use a recent example, if that's okay, from my own life. Okay. So I'm going to explain, first of all, the basic 6 buffers are just, they sound so simple. We don't want to do them, right? Or we think we already are. But while I talk, maybe picture the hardest client you've ever worked with, or maybe the toughest family member or caregiver you have ever tried to train. And just think, do they have all these 6 things all the time? Okay. And then what might their barriers to this be? A nurturing relationship, nutrition, exercise, sleep, mental health, and stress relief. So those are the basic 6. Now, if you look at articles on things like resilience and protective factors, you will find varying lists of varying lengths. Some of them have 21 factors. Some of those factors kind of seem to blame the person, like, ooh, it's a buffer if you grow up in a nonviolent neighborhood. Good for you. I wish everybody did, right? But buffers are different because they are 6 things that the medical literature suggests actually can help solve the medical changes that happen after you're exposed to trauma or serious aversives. Okay. And so those 6 things, I started getting really into this when I wanted to do more preventive behavior analysis. And I really love where that started. You know, Dr. Shal Ali Rosales talking about how can we set up students and children and families to have the skills necessary to deal with what they're going to need. And so maybe pre-teaching the 4 functions, maybe that's like a early 2000s view of preventive behavior analysis, right? But Dr. Nadine Burke-Harris, who I always have to drop her name because she champions this topic about ACEs and about how the 6 buffers really do reverse the trajectory for people, how it works over a lifetime, how you can add it at any age. You don't have to have experienced trauma to add the buffers or to need the buffers. And so people probably remember a few years ago when COVID happened, Dr. Nadine Burke-Harris was the Surgeon General of California. She was about to give our B.F. Skinner lecture at ABAI, but got called away to do that and deal with her duties. And this is what she was going to talk about. Well, when I read her book, The Deepest Well, I was inspired and very, very frustrated because I thought, this is so behavioral, generating these schedules that allow every person to access the buffers. So behavioral, right? And then when I started asking colleagues and looking at my behavior plans, you know when we used buffers in behavior analysis? When they related to a problem to decrease. And that was the only time. If the student had an issue with nutrition, we talked to an OT who dealt with that, or a speech path. If the student had a sleep issue, we worked on that in regards to reducing their sleep problems, but never And aside from some great work that we were doing in developmental intervention, by the way, but aside from that kind of stuff, we almost never interviewed a staff member and said, hey, just wanted to make sure you got enough to eat. Your family member getting the exercise you need? Are you fulfilled right now, mental health wise? And I'm going to drop a note that I do want to talk about the mental health buffer and stress relief one just a little bit if it comes up, because those are sort of fuzzy. It's harder to describe those behaviorally. But I figured, okay, Dr. Nadine Burke-Harris is onto something huge. But in behavioral terms, what are these? What are they? And do we have a form? Are we checking these off in the FBA? That's what we need. And so that's when I published that article to really provide a good, clean operational definition of this, relate it to every single, relate every buffer to the body of behavioral literature that already exists to sort of make it accessible to behavior analysts. We do have some courses on Cusp Emergence University that dive into that kind of stuff, how this relates to our ethics code and our behavioral purview in terms of your scope and competence. So that was not just a little about buffers, but I hope that you see how accessible they can be and how we do them as antecedent variables. When I work with a new client, a company, a new caregiver, we do this stuff before we even onboard.
And I'm really hoping that in a few years from now, this will be the gold standard. This is just going to be what people do because it is so crucial. You've got a bunch of information on your website, cuspemergence.com, on buffers. So if you want more information on that, go there. You're also going to be discussing buffers in your upcoming CEU with us and diving into it a bit further. So I'm looking forward to that. Cusp Emergence University does a really great job with going into like a deep dive into it. And you offer a zillion CEUs on trauma. And it's, I think it's really important in this field.
And we'll link the article that you reference, because I think it's also really helpful. And I think what you mentioned in the article is not unique to the clients or the families that we work with. You're saying it's for all of us. Like any of us should be putting these things. We all work in, stressful settings. I actually interviewed somebody recently, and one of her questions to me was, how do you manage staff, burnout, or how do you prevent burnout and manage self-care? And you know what, I gave some answers, but the truth is, I don't know how she would perceive her own stress relief. We offer yoga and we offer, paid time off and all of these things, but it is so individualized. So how could we really put antecedent strategies in place if I don't know what someone else is perceiving as, stress relief?
I love that question, right? A couple of things that you reminded me of, Shira. So we have a really cool little package about gifting, because if a company really wants to know, they could ask. One of the most precious things we can do is to say, how could I solve a barrier that is somehow impeding your access to these buffers? And how can I solve a barrier and gift a buffer at the same time? I usually give the example of, you want to really help me? Watch my kids for an hour while I do yoga. Or call my mom, So that's,
I wouldn't want either of those things, by the way.
Right? Why would you want that?
No way.
Yeah, exactly. Companies have really, so we do a lot of system support trainings and work. And when we have this from a complete integrated package, so you're onboarded with an idea about the buffers. You're given this pamphlet for wherever these things are in your community. You're given these questionnaires. If we had our staff meetings, some were fun. You guys want rock climbing gym, a yoga studio, a beautiful plant garden to just chill out in and then to explore. Everybody's so different. So that's one thing. But then look at the literature, because in behavior analysis in psychology, and this is a piece of it that Dr. Nadine Burke-Harris didn't really get into. She talked about in stress relief. She talked about mindfulness a little bit. Certainly behavioral relaxation training, that's amazing. But do you know what really prevents the whole stress response? Is two things. The literature tells us predicting and controlling the stressor. That's it. And so I taught just a second ago, I said I was going to use a little of my experience. I had to get this dental work done. I didn't want to avoid it anymore. It was a really long procedure. All my gums were involved. And I thought, okay, prediction. Number one, all right, I'm going to schedule this. It's not going to be, they're not going to tell me when it is. I'm going to give them some dates. Just that initial feeling of, I'm going to take some control. And then I could not do several things. I couldn't eat, drink hot or cold or alcoholic liquids. If smoking was an issue, I wouldn't have been able to do that. I couldn't have crunchy foods or sweet or spicy foods. Well, that just about covers all my cravings, right? And I used this as a beautiful opportunity, as though it was a gift to teach me, how am I going to do for 2 weeks? It's this beautiful gift of 2-week habit free, right? I could not engage in any of those. I'm triggered. I'm going to engage in consumption of something. I talked to my dentist about this when I went back, and I said, it was such a gift. I felt amazing after that because I got distance between my triggers and my behavior, my response, because I had to turn to something else. I had to use mindfulness instead. I couldn't satisfy any of those cravings. Well, I chose to deal with that way because I'm researching response to aversives, right? I want to know, how am I going to heal fastest? It's by not letting the stress change your brain and body in a negative way. It turns out that even when I use this with my foster kids, and let's say they've got this uncontrollable stressor, they've got to meet with previously abusive mom every Wednesday because of the reunification project that's going on. And so what are they doing? Lots of counter control. They're slamming the Zoom screen. They're breaking the headphones. They're exerting control. In other words, they're doing everything they can to survive. And they are predicting and controlling the situation. Could you somehow let someone do that in a way that is acceptable to both you and the client, right? And once you do that, it's fine, right? So it's creating repertoires for my Zoom client instead to say, I need a break from this topic. It's putting stimulus control over the things that mom is going to bring up. It's teaching a caregiver to watch out for a hand signal that says, I need a break. It's all that stuff we would have done in behavior analysis anyway if we were really on fire, but it's super intentional. And so that's the stress relief buffer, is actually, you identify your stressors, baby, for the next week. And then the boss goes, what's coming up for you and how can I help? Or how are you going to manage it?
We can't take those appointments away. We can't change the external environment going on around us, but we can change our thoughts around the behavior. Really, you change your thoughts, you change the behavior, right?
And your reactions in the presence of it. I mean, whether you do something to approach it or to avoid it, it's helplessness if you don't respond to it. But if you engage in it in a positive way, it literally changes your brain. And that's like the Marty Seligman, that's what the Hope Circuit's about. Meyer and Seligman, who did Learned Helplessness, their retrospective shows they kind of got it wrong. This is where it's at, is how can we do positive control? Helplessness doesn't happen if you're controlling your responses to it.
So true. You mentioned that, using all of our behavior analysis tools like we've always had. And, I've been in the field a while, Shayna, and you probably longer. It seems to me like trauma-informed behavior analysis is a more recent buzzword. I don't remember hearing about it 10, 15 years ago. But do you think that behavior analysis was always really trauma-informed, or is it a new kind of revelation within our world?
Oh, girl. I have worked in so many environments and settings where the caregivers, whether it was at a group home or a group of social workers or even a group of RBTs, and long ago before we even had that acronym, right? I worked in so many environments where they cried when the behavior analyst left the room and said, he's berating me for not running the plan right. He's not listening to why I can't really do what he's suggesting. No, I don't think that we have always been trauma informed. I think we've always had the tools to be. Okay. I think that what Bear, Risley and Mies actually, what they did with little Dickie who wouldn't wear his glasses, I think what they were doing was probably trauma informed. They were addressing this root reason for why this family is unhappy and this boy is institutionalized in the 50s, right? We've always had the tools to do this. As soon as Skinner and others helped operationalize what we could do with it, I think it's on us now. It's on us humans to be like Sidman. Don't be coercive, right? Listen. I think a lot of what Gold Diamond has done as well, and what TV Joe Lang and Paul Andronis have started to popularize more, and then this new wave of the constructional approach, that gets a lot closer to being trauma-informed as well. But no, I don't think the everyday application of behavior analysis has been trauma-informed. There has always been this question, what is it exactly? Are we trauma-assumed? If you look at Greg Hanley's work, and one of the great articles he has on his site, he's advocating for just think about trauma as something that probably your clients went through, period. And just go from there and be kind, I don't disagree with that at all. But part of being trauma-informed also requires an additional layer of ethical responsibility. And that's part of what Cusp Emergence University brings when we write about stuff like the safety model, for instance. I didn't do that because I wanted to. I did it because I was working in this environment where about 30 stakeholders, including hospital administrators of a massive mental care facility where people had lived for 20 years, maybe with head injuries, and now they have no place to go. And so this big mental institution, they needed heavy, hardcore risk versus risk documentation about all the influences and impacts of trauma. So when I brought that layer of additional risk versus benefit documentation, I was in a whole new area of work. And when you go in a really intense case impacted by many different variables with respect to trauma, you do have to do that additional layer. What if you're called to court? What if the child's father says this? What if you haven't documented that? And so that's also very important. And no, we weren't always doing it. I wasn't. But trying to document some of the tools that helped me and share them is just kind of the space I'm in right now.
I love the honesty and the resources that you're now learning and providing, because we're getting to learn from your experiences, which is amazing through Cusp Emergence.
Hope so.
Something that we like to, offer our audience is a piece of advice that either you wish you had, best advice you were ever given, or something you would tell, somebody just getting into the field. What advice could you offer?
Ooh, I love that question. It's kind of like Matt Sequoia's newly minted BCBA question, right? So I have blogged about this before, and I can sure share that with your listeners at some point. But one of my biggest things, and one of the cool things that I do with every mentee or a supervisee, is to have them operationalize where they want to be in 5 years. Okay? Because that cuts right through to their values and where they really want to go. And all the complaints about their current environment will evaporate as you start to see this joy of them moving towards something all of a sudden. If you operationalize that and then do the first 5 steps, you're basically there, right? And so how I usually do that is my supervisees will audit where they want to be. So for example, if you want to work in foster care, maybe you just go start attending like a support group for parents who are fostering. Sit there, be quiet, show respect. Look at those social workers who've done the work for 20 years. Don't say anything. Don't give advice. Don't try to say, but what was the function? Just listen.
Never say what was the function.
Right. And I've learned so much from auditing support groups and then figuring out eventually where I could fit in, sure, but sometimes it just built my empathy with the kind of person I wanted to be and work with. And so that has been so helpful for me as an individual, but also the people that I work around and shadow and have been teaching.
I love that. It actually brings back memories when I first got into the field. I loved it. I fell headfirst in love with ABA and autism. And I used to carry around a notebook. And I feel like I need to start doing that again. But I had a notebook and I actually taped a penny to the front of the notebook because it was a penny for my dreams. And I just wrote down everything in terms of what I want to do, what I thought I want to do, what I didn't want to do. And I would put the book by my nightstand. So in the middle of the night, if I ever woke up and there was something going through my head in terms of that, I'd write it down in there. And it was really cool because I actually stuck to that and made up plans for that. We also have a CEU asynchronous webinar on planning for yourself. And we use ACT and we use a few other strategies in there, but it's really about writing out your long-term vision. What are your values? Writing out your long-term vision, and then breaking that down into smaller, digestible components and actionable items.
Beautiful, Shayna. And I think it's very Skinnerian of you too. And it's even more so if you had like your pen taped to your hand and it's like falling off the bed. You wake up and you write down your idea. Not so far off. And it really does work to just kind of keep tabs. One additional thing is to do the buffers because it's ethical. Do them for yourself because it is ethical, right? There's a note in the ethics code about being able to check in with yourself and self-monitor if things are getting in the way of your work with clients, things like your own personal relationship or diet, all these kinds of things. Who do you know that does that? What tools do you know that do that? Buffers check-in can do that. And then when something changes for you, somebody passes away, you get a new job, you get a new partner, whatever it is, do that again. And kind of readjust. So yeah, I'm like you, and I'm never too far from my notebook. I think it's a really nice tool to have with you all the time.
Yeah. Well, I can keep going because I have so many more questions, but I think we'll save it for the webinar, which I'm also excited to hear more about the buffers. So for everyone who hopefully you'll join us, the webinar is scheduled for January 22nd. It is going to be 3:30 Eastern time, which is a different time for us. So everyone mark it in your calendar. It's a Wednesday, and we are super excited to have you then learning more about buffers and really how to level up your practice. So thank you for being here. And thank you for, responding to our requests and to learn more about this topic and for all you're doing for everybody in this field. We really appreciate it.
Same to you. Thank you for what you're doing, both of you in the field, your listeners who are out there applying this stuff. That's where it's at. Thank you so much.